Here, Mimi McKellar shows us how to tube feed her daughter, Maddie. We decided to use blue Gatorade so our audience would be able to see the fluid enter the G-tube. You're going to fill the connecting tube partially with the fluid. Then release the clamp and let the fluid drain. Reclamp, this way no air bubbles enter the stomach, and refill with the amount of fluid needed by your patient. You're then going to insert the connecting tube to the Mickey tube and align the two lines. Rotate to the right to open the Mickey tube and release the clamp. Now at this point, the fluid is flowing into the stomach, and this is done by gravity. As you can see, Maddie's a little upset. This is because her G-tube had just been changed from an old one to a new one, and the new one was a size larger. So the new tube is a bit uncomfortable, but she will get used to it, and the actual tube feeding causes her no discomfort. At this point, you'll see the fluid drop very rapidly, rise again, and drop down lower. At this point, Maddie is talking and holding her stomach tight, so this is very common. Wait till it levels out and clamp the tube. Rotate to the left to close the G-tube and put the cover back over. That's it. Your tube feed is done.
All right, so I'm here today with the owner of Central Coast Gymnastics, Mimi McKellar, and she is going to tell us a little bit about her daughter, Maddie, and their experience with feeding tubes. What was Maddie's official diagnosis that led her to getting?
She has what's called PVL, which is periventricular leukomalacia. And PVL is any infant that's born premature, which Maddie was 5.5 weeks premature, and develops an infection. Their body doesn't have the ability to fight it off. So it spreads throughout their whole body and typically settles in their brain.
And how was she diagnosed? Were there symptoms of failure to thrive and not gaining weight, or when it comes to nutrition, how was?
Yeah, so she couldn't swallow. She couldn't bottle feed or breastfeed. Everybody in the hospital tried to bottle feed her. She also had a cleft palate in the soft palate, and so they were assuming some of her swallowing issues was due to that, plus brain damage, plus a preemie. So they didn't really tell us anything. They just said she had neurological damage, and we didn't really learn more about how bad it was until she was about 5 months old. At 5 months, we took her to Cedars-Sinai, and she still had an NG tube, and they were very frustrated because that's a very temporary way of feeding, usually 3 to 4 weeks.
Yeah.
So she's 5 months old, and she still has an NG tube. So yeah, so we really did not have a clear understanding of her until we saw a neurologist at Stanford when she was 2.
Wow.
And she was diagnosed with moderate CP right after that.
Gotcha. And what kind of formulas would you use with her?
Back then, they would send us a case or 2 cases or 3 cases. It's non-dairy pediatric vanilla smelling formula. And at the time, we were giving her 1 cc of food per calorie. So the volume was high. And we had tried different foods. They did a celiac test. They scoped her when I was at Children's LA. So they did all these tests on her, and there was no reason for her to be thrown up. We could never figure out why, except for when we went to Stanford, they said the volume is too much. Give her less volume with more calorie. So they switched us to a formula that was 1.5 calories per cc, and we were able to give her less volume but more calories. Basically, I started introducing a little bit of food by mouth. She was in OT, and what we would do is we made a plan. We would tube feed her. No, we would oral feed her, and then if she choked and threw up, it was okay, which she did. It was very soft things, very little by mouth. We're talking like 2 bites of a baby spoon, and then we would tube feed her the rest, like her normal.
So my next question is, what did you learn from tube feeding?
Basically, the most important thing that some of the bigger hospitals stressed to us was nutrition. get calories in your child. So Andy and I always felt really good that Maddie was getting really good nutrition because we were getting formula in her.
What advice would you have for any other parents who are going through this kind of situation?
First of all, do a G-tube. Don't even delay, because getting nutrition in your child is more important than anything else. You know, because it just takes away that stress.
Yeah.
Because you can get the nutrition in your child.
And then you can focus on
Everything else. Yeah, yeah.
And then our last question is, do you have anything else you want to share with our class about Maddie?
Well, I think one, just, and I own Central Coast Gymnastics, and kind of a mission that we're on now is trying to get children between the ages of 0 and 3 in here at no cost. So, trying to get the families and we're working on connecting with more special needs in the community at a younger age. Our goal is to get the under 3 in here as soon as possible because of what I learned about Maddie's brain. And just a tremendous amount of brain development happens between the ages of 0 and 3.
You need that nutrition.
The nutrition, I will never forget how much they stress that to us. So the nutrition, the tube feeding, you know, and they need the nutrition for energy. I mean, that's the other thing. Maddie has CP, so you know she was taking naps even as she was older because she was just physically exhausted. It's harder work for her to move. You can't tell now. Hey Maddie, I think you should show them how you have taught yourself a front flip on the trampoline. So, yeah. This is